Hello everyone, now let us discuss about CPT coding guidelines for medicine part 7. In the current session, we will be discussing about ophthalmology. Now coming to the various sessions or sections in the ophthalmology, it is divided into general ophthalmological services, special ophthalmological services, contact lens services, spectacle services. The special ophthalmological services are again divided into ophthalmoscopy and other specialized services. The respective CPTs are given under these headings. First of all, coming to general ophthalmological services, they are divided into intermediate services and comprehensive services. The basic difference between intermediate and comprehensive services is enlisted here. Coming to intermediate services, it involves evaluation of new or existing condition which is complicated with a new diagnostic or malignant problem. It can be termed as intermediate service. The condition can be new or existing, which is complicated with a new diagnostic or management problem. For example, review of history, external examination, ophthalmoscopy, biomicroscopy for an acute complicated condition. For example, iritis, not requiring comprehensive services. That is one example. The second example is tonometry in established patient with known cataract not requiring comprehensive services. These are the examples for intermediate services. Now coming to comprehensive services, it involves general evaluation of complete visual system. The basic difference is the comprehensive services, it involves general evaluation of complete visual system. It constitutes a single service entity but need not be performed in one session. This is important point. The comprehensive services need not be performed in one session. They can take 2 or more sessions. And the comprehensive services generally includes history, general exam, medical observation, external and ophthalmoscopic examinations, gross visual fields, basic sensory motor examination, etc. And they always includes initiation of diagnostic or treatment plan. Initiation means beginning of any diagnostic or treatment plan. For example, prescription of medication, arranging for special diagnostic or treatment services, consultations, laboratory procedures, and radiological services. Let us see an example. For diagnosis and treatment of a patient with symptoms including possible disease of visual system such as glaucoma, cataract, or retinal disease, or to rule out a possible disease of visual system. Whenever the physician performs comprehensive service for diagnosis of a possible retinal disease or to rule out a possible retinal disease, in these cases, comprehensive services can be coded, and they usually always include initiation of diagnostic or treatment plans. Now coming to the CPTs. For new patient, for intermediate services, the CPT is 92002, and for new patient for comprehensive services, 1 or more visits, the CPT is 92004. And for established patient for intermediate services, the CPT is 92012. And for comprehensive services for established patient, 1 or more visits, the CPT is 92014. Now coming to the next category, that is special ophthalmological services. They describe the services in which a special evaluation of part of visual system is made, which goes beyond the services included under the general ophthalmological services or treatment. These are reported in addition to general ophthalmological services or E&M services. The special ophthalmological services are reported in addition to general services or E&M services. Examples are fluorescein angioscopy, quantitative visual field examination, refraction or extended color vision examination, All these services should be reported separately. The next category is extended ophthalmoscopy. This also comes under special ophthalmological services. It includes a detailed retinal drawing for disc, macula or periphery accompanied by an interpretation and plan. The drawing should be anatomically specific to the patient and clearly labeled and be of sufficient size, usually no less than 2.5 inches in diameter. Next, coming to fluorescent angiography, the CPTs are 922352, 92242. Here, a fluorescent dye is injected in a peripheral vein to enhance the imaging, and series of multi-frame angiographies performed to evaluate the choroidal and retinal circulation. In this illustration, arteries display an even fluorescence and veins appear stripped from the lamellar dye flow. That is the basic principle in this fluorescent angiography. Next, coming to other specialized services, it usually includes ERG, which is nothing but electroretinography, or for prescription fitting and medical supervision of ocular prosthetic devices. Whereas electroretinography is used to evaluate the function of retina and optic nerve of eye, including photoreceptors and ganglionic cells. These two come under other specialized services. Now coming to the various CPTs that come under special ophthalmological services. The first one is 92015. It is used for the determination of refractive state. 92015 is used for the determination of refractive state. The next CPT is 92018. It is used for ophthalmological examination and evaluation under a general anesthesia with or without manipulation of globe for passive range of motion or other manipulation to facilitate diagnostic examination complete. For complete ophthalmological examination and evaluation under general anesthesia with or without manipulation of the globe for passive range of motion or other manipulation to facilitate diagnostic examination, the CPT is 92018. And if the examination is limited, you need to report 92019. The next CPT is 92020. It is given for gonioscopy. The next CPT is 92025. It is used for computerized corneal topography, unilateral or bilateral, with interpretation and report. The next CPT is 92060. It is used for sensory motor examination with multiple measurements of ocular deviation. For example, restrictive or paretic muscle with diplopia with interpretation and report. The next CPT is 92065. It is given for orthooptic training performed by a physician or other qualified healthcare professional. The next CPT is 92066. For orthooptic training under supervision of a physician or other qualified healthcare professional. If the orthooptic training is performed by physician, you need to report 92065. If it is under the supervision of the physician, you need to report 92066. The next CPT is 92071. It is used for fitting of contact lens for the treatment of ocular surface disease. The next is 92072. It is given for fitting of contact lens for management of keratoconus initial fitting. The next CPT is 92081. It is given for visual field examination, unilateral or bilateral with interpretation and report, limited examination. For example, tangent screen, autoplot, arc perimeter or single stimulus level automated test such as Octopus 3 or 7 equivalent. And for intermediate examination, the CPT is 92082, and for extended examination, the CPT is 92083. For visual field examination limited, the first CPT is 92081. For intermediate visual field examination, the CPT is 92083, and for extended visual field examination, the CPT is 92083. For intermediate, it is 82. For extended, it is 83, and for limited, it is 81. The next CPT is 92100. It is given for serial tonometry with multiple measurements of intraocular pressure over an extended time period with interpretation and report same day. The next is 92132. It is given for scanning computerized ophthalmic diagnostic imaging anterior segment with interpretation and report unilateral or bilateral. The next CPT is 92133 for scanning computerized ophthalmic diagnostic imaging posterior segment. Previously it is anterior segment, now it is posterior segment with interpretation and report unilateral or bilateral optic nerve. The CPT is 92133. And for retina, for optic nerve, the CPT is 92133. For retina, the CPT is 92134. That is for scanning computerized ophthalmic diagnostic imaging posterior segment with interpretation and report unilateral or bilateral. For retina, the CPT is 92134. The next CPT is 92136 for ophthalmic biometry by partial coherence interferometry with intraocular lens power calculation. The next is 92145. It is given for corneal hysteresis determination by air impulse stimulation, unilateral or bilateral with interpretation and report. Next, coming to ophthalmoscopy. The first CPT under ophthalmoscopy is 92201. Ophthalmoscopy extended with retinal drawing and scleral depression of peripheral retinal disease, for example, retinal tear, retinal detachment or retinal tumor with interpretation and report unilateral or bilateral. The CPT is 92201. For extended ophthalmoscopy, the CPT is 92201. With the retinal drawing and scleral depression of peripheral retina. Here you can see the clinical drawing of peripheral retinal disease. This is an example for 92201. And coming to 92202, it includes with the drawing of optic nerve or macula. For example, glaucoma, macular pathology or tumor with interpretation and report. If the ophthalmoscopy is performed with retinal drawing and scleral depression of peripheral retinal disease, the CPT is 92201. If it is done with drawing of optic nerve or macula, the CPT is 92202. Here you can see this is the example for 92202. Here the drawing of optic nerve is also shown. Optic disc diameter, cup diameter, the thinning of the neuroretinal rim area, vessel torosity, all these things are drawn here. This is an example. Coming to next CPT, it includes 92227. It includes imaging of retina for detection or monitoring of disease with remote clinical staff review or report. Next is 92228. It includes with the remote physician or other qualified healthcare professional interpretation and report. If the imaging of retina is performed with the clinical staff, it can be coded with 92227. If it is done by a physician, you need to code 92228. The next CPT is 92229. It includes point of care, autonomous analysis and report, unilateral and bilateral. That is the imaging of retina for detection or monitoring of disease with the point of care, autonomous analysis and report, unilateral or bilateral. You need to report 92229. The next is 92230. It includes fluorescein angioscopy with interpretation and report. The next is 92235. It includes fluorescein angiography, including multi-frame imaging with interpretation and report, unilateral or bilateral. Here you can see the example for 92235. Here a fluorescent dye is injected in a peripheral vein to enhance the imaging. Serial multi-frame angiography is performed to evaluate the choroidal and retinal circulation. In the illustration, the arteries display an even fluorescence, while the veins appear stripped from the laminar dye fluid. This is an example for 92235. The basic difference is 92235 includes multi-frame imaging. If the term multi-frame imaging is given, you need to code 92235. The next CPT is 92240. It includes iodocyanin green angiography, including multi-frame imaging with interpretation and report, unilateral or bilateral. The next CPT is 92242. It includes fluorescent angiography and iodocyanin green angiography, both, including multi-frame imaging performed at the same patient encounter with interpretation and report, unilateral or bilateral. The CPT is 92242. Next, coming to other specialized services. The first CPT is 92265. It includes needle oculoelectromyography, one or more extraocular muscles, one or both eyes with interpretation and report. The next is 92270. It includes electrooculography. Previously it is needle oculoelectromyography. Now it is electrooculography with interpretation and report. The CPT is 92270. The next is 92273. It includes electroretinography, which is nothing but ERG with interpretation and report, full field. Examples are FFERG, Flash ERG and Gans-Fled ERG. Whenever you find these terms, you need to code 92273. And for ERG, if it is multifocal, you need to report 92274. The next CPT is 92283. It includes color vision examination extended. Example, anomaloscope or equivalent. The next is 92284. It includes diagnostic dark adaptation examination with interpretation and report. The next is 92285. It includes external ocular photography with interpretation and report for documentation of medical progress. Example, close-up photography, slit lamp photography or goniophotography or stereo photography. The next CPT is 92286. It includes anterior segment imaging with interpretation and report with specular microscopy and endothelial cell analysis. The next is 92287. It includes anterior segment imaging with interpretation and report with fluorescein angiography. Now coming to the next session, it includes contact lens services. Here the prescription of contact lens includes optical and physical characteristics like power, curvature, flexibility, size. And this is not a part of general services. And it also includes instruction and training of wearer and incidental revision of lens during training period. And follow-up of successfully fitted extended wear lenses is reported as general ophthalmological services. This is important. The follow-up contact lens services are reported as general ophthalmological services, and supply of contact lens reported as a part of service of fitting must be reported separately. The supply codes must be reported separately. Now coming to the CPTs for contact lens services. The first is 92310. It includes prescription of optical and physical characteristics of and fitting of contact lens with medical supervision of adaptation, corneal lens, both eyes except for aphakia. The next is 92311. It includes prescription of optical and physical characteristics of and fitting of contact lens with medical supervision of adaptation, corneal lens for aphakia. It is for except aphakia. The CPT is 92310. And for prescription of contact lens for aphakia, 19, the CPT is 92311. And for aphakia both eyes, the CPT is 92312. And for prescription of corneoscleral lens, the CPT is 92313. Next, coming to 92314, it includes prescription of optical and physical characteristics of contact lens. Previously, it is with the medical supervision of adaptation and direction of fitting by independent technician, corneal lens, both eyes except for aphakia. From the previous CPTs, 92314 is including additionally independent technician. If an independent technician is included, you need to report the 92314 series. If the independent independent technician is not included, you need to report 92310 to 92313. If an independent technician is included, you need to report 92314. And for prescription of corneal lens for aphakia 19 with independent technician, the CPT is 92315. And for prescription of corneal lens for aphakia both eyes with independent technician, the CPT is 92316. And for prescription of corneoscleral lens with independent training by independent technician, the CPT is 92317. The next CPT is 92325. It includes modification of contact lens with the medical supervision of adaptation. The next CPT is 92326. It includes replacement of contact lens. The CPT for replacement of contact lens is 92326. Next, coming to other session, that is spectacle services. It includes fitting of spectacles is a separate service. The fitting of spectacles is a separate service. It includes determination of refractive state, specification of lens type, whether it is monofocal or bifocal, lens power, axis, prism, and absorptive factor. And fitting includes anatomical facial characteristics, writing of laboratory specifications, and final adjustment of spectacles. And presence of healthcare professional or physician is not required for spectacle services. And supply of materials is a separate service and it is not included in this. The supply codes must be reported separately. Now let us see the various CPTs. The first CPT is 92340. It includes fitting of spectacles except for aphakia monofocal. The lens type is monofocal. And if it is bifocal, the CPT is 92314. And if it is multifocal, the CPT is 92342. Next, coming to 92352. It includes fitting of spectacle prosthesis for aphakia monofocal. And if it is multifocal, the CPT is 92353. The next CPT is 92354. It includes fitting of spectacle mounted low vision aid, single element system. If it is telescopic or other compound lens system, the CPT is 92355. The next CPT is 92358. It includes prosthesis service for aphakia temporary, that is disposable or loan including materials. The next is 92370. It includes repair and refitting spectacles except for aphakia. The next is 92371. It includes repair and refitting spectacles for aphakia. Spectacle prosthesis for aphakia. For the repair and refitting of spectacle prosthesis for aphakia, the CPT is 92371. Now let us see some of the example. A person came for prescription of optical and physical characteristics of contact lens with medical supervision and direction of fitting of corneal lens of aphakia by independent technician for left eye. Here an independent technician is there, and for fitting of corneal lens for aphakia, one eye. So the CPT is 92315. Prescription of optical and physical characteristics of contact lens with medical supervision and direction of fitting of corneal lens for aphakia, one eye. The next CPT is, next example is patient presence for flash ERG. So the CPT is 92273, which is nothing but electroretinography with interpretation and report fulfilled. The next example is patient presence for gonioscopy, and the CPT for gonioscopy is 92020. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.